really great to be here. I am in my home in Colfax, California, but I'm wearing this mask to underscore how important it is for us to follow the COVID guidelines, which is wear your mask, washing your hands, physical distancing, and trying to stay as safe as possible. I wanted to start with just a couple of moments of silence as we think about the victims of the campfire and victims of the current pandemic. So if we could just have maybe about 10, 15 seconds where everybody thinks about that, and not only in a negative way, because there are a lot of great things that have transpired on the ridge that have come out of tragedy. Okay, so what I want to do today is talk with you about why immunizations, vaccinations are important, not just for children, but for adults. And I want to start with a story. In 1985, there was an earthquake in Mexico City. And I went down there as part of a relief effort with the Salvation Army. By the time we got to the clinic, which was really a church, there were about 1,000 patients waiting for us and the rest of the physicians to see. And I got to meet a physician who had just come back from Africa, where he was working with the Salvation Army. And it was one of the many epidemics of measles that happens in Africa. And he related the story of one particular child who was needed assistance in breathing. So they put a tube in the mouth, down into the lungs, but there's no electricity. So they had to have the family and the staff and friends come in and help this child breathe by basically squeezing a balloon and blowing the air in, letting it out, and then the air would come out. And they did this for 2 weeks. Finally, the child started getting better, took the tube out, started eating. And because so many other people had not survived measles, the staff decided they would have a celebration. And at that celebration, they had food and stuff to drink, and the family came and the friends came and the staff was there, and everybody talked about how wonderful it was that this child survived and all the efforts, and everybody thanked everybody. And then the mother had the last word, and she thanked everybody and said, "Thank you so much for making my child better." And then she looked up and she wiped the tears from her eyes and she said, "Where were you when all of this could have been avoided with a simple vaccine? One shot at 12 months of age, a couple of bucks, and none of this would have ever happened." So I want you to think about that as we hear about vaccines and why people don't want to do them and how unsafe they are. And I'm going to delve into that a little bit more. According to the World Health Organization, this year, 200,000 people have died of measles. 200,000 people, mostly children, and almost everybody not vaccinated. So it's very important to get children vaccinated, but we're going to have a vaccine shortly, maybe as early as next week, for the COVID-19. And we're seeing polls where people say, "I don't want to get vaccinated." There's some kind of conspiracy theory. That the one that sort of struck my chord was that somehow Bill Gates was injecting nanoparticles into people with these vaccines so he could control them. I mean, these things are, these are from the planet Mars or beyond. So it's very important to get vaccinated. And even if the COVID-19 vaccine, even if that wasn't here, adults get vaccines all the time. And you should make sure that you are up to date with your provider. Now, I hear a lot of negative things about vaccines, that they cause autism. They do not cause autism. Dr. Wakefield, who started that by a publication, had that publication retracted, actually lost his medical license, and it was later found out that the people who sponsored his research were people who were not wanting to vaccinate children because of a variety of things that they thought caused autism. But it doesn't cause autism. There's lots of studies to show that. So please don't use that as an argument. for not getting vaccinated. Of course, there are side effects of vaccines. They hurt. That's one of the reasons children hate pediatricians. That's why I hated my pediatrician. He stuck me with needles. I mean, come on. But they hurt. Sometimes they cause redness at that area where the injection is given. And sometimes people get fevers from them. But the really serious complications where you have swelling of the brain, or you have a bad anaphylactic reaction where you can't breathe, or children lose developmental milestones, like they don't talk as well, they don't walk as well. These are very, very rare complications. They do exist. But I would also ask everybody that the next time you get in your car, think about the risks and the benefits of driving that automobile are. The benefit is that you're going to be able to go somewhere that you couldn't, maybe more comfortably. Maybe you've got a big load that you couldn't possibly carry, or maybe you've got to drive 200 miles and it's just not possible to walk. The risk is that there could be a crash. You could be hurt. You could hurt somebody. So that happens in everyday life, and we don't necessarily think about that, but we do need to think about it with any kind of a medical procedure, including vaccinations. So what is the risk of vaccinations? There are some serious ones, but they're extraordinarily rare. What is the benefit? You're not going to get polio. You're not going to get measles. You're not going to get diphtheria, and a whole host of other problems that we can avoid. So why would we not want to vaccinate people? There's a lot of stuff on the internet that is phony. There's a lot of stuff that is being pushed by people who have lots of money to be able to do this. And you really need to sit down with your provider and go through the information. The information I'm giving you is all available on the internet at reputable internet sites. And if you don't know how to do that, I'm more than happy to talk with you about how do you get to a reputable site. Look at the information for yourself. And then if you can't answer the questions you have, ask your provider. I have never taken one dime in salary from a drug company. Drug companies are here to make money, yes. Maybe they make too much money. We can discuss that. But in terms of physicians and nurse practitioners and physician assistants just doing these things to make the drug companies rich, I don't think so. If we didn't have the vaccines, our hospitals would be filled, as they are now, with a viral infection that could have been prevented. So I want to encourage you to ask questions. I want to encourage you to get vaccinated. And if you haven't gotten the flu vaccine, it's a great place to start. If you get your vaccine today, it's going to be well into December before you actually have developed enough immunity to fight off the flu. Some people think they get the flu from the vaccine. And for the injections, that is impossible because there is no virus. There's only a small part of the virus in the vaccine. You can get a side effect, like I said, fever, chills. Sounds like the flu, right? It's not the flu. You could also have just gotten the flu, but it's not from getting the flu from the vaccine.
The word efficacy keeps coming across the screen when we hear about immunizations, especially now when you're seeing a lot on the news. Can you explain just in a few sentences what efficacy means and how that's important?
Sure. So there's different kinds of efficacy. The efficacy you're hearing about the pandemic virus is efficacy in the laboratory. In other words, people are given the immunization and then they take their blood out and do a variety of tests to see if they have responded to the vaccine. That is a good indicator that they will respond to the virus. But what you really want is to know, if we get vaccinated, when that virus comes across, will we respond to it? So when I get a polio immunization, I know when I come in contact with polio virus, I'm going to be immune to it and I will not get polio. So there's different levels. Right now, the pandemic vaccine is really laboratory based, and we'll see what happens when those folks come in contact with the virus.
And then the last question is, somebody said, hey, when I get my vaccine, do I have to still wear a mask?
Yes, you do. Because we don't, as I said, the efficacy right now is giving the vaccine and looking at the response to the vaccine.
Mhm.
But that won't guarantee that there'll be a response to the virus. So until we really get that information, I would really suggest that you follow wearing a mask, lots of hand washing, and lots of physical distancing. I don't like the term social distancing because
Mhm.
we need to be socially together.
Well
We need to
said.
be physically separated. And there's a difference in that.
Mhm. Right. Absolutely. Well said. But we also want to encourage you that when we get done with this video, that you go for a walk. You get outside. Being outside and yes, and getting some sunshine and fresh air, that's only going to help with your immunity. It's only going to help with your bringing up your endorphins, going to help you just feel better. And I feel like it's going to help me get a breath of fresh air when I get done. It's going to be so good for my body, for your body, for everyone. So anything you want to finish with before we leave today?
No, I want to thank you for doing this. I think this is very important. We have gotten so entrenched in this virus. I think we've forgotten a lot about what real life is like. It's going to come back some point. I don't know when, but we have to remember that just because we have to stay uh, distant from each other, we still have to take care of ourselves. We know that there are a lot of people who are not going to their physicians, not going to their practitioners, and are getting sick because of that.
Mm.
So I think that things that Aaron is doing to try to bring things together to highlight the importance of ongoing relationships and also the exercise, I think that's really important. So I just wanted to thank you for doing this and continuing to try to keep things moving on the ridge in a positive direction.